Hello, this is Dr. Mercola, and I'd like to share some information about a very important topic for many women, because up to 75% of women will experience a yeast infection in their lifetime. And why is that? Well, a number of reasons. I believe one of the most important ones is that the choice of food that most women are making, and that is they're choosing foods that are high in sugars and processed foods that will actually serve as fertilizer for the growth of yeast and fungi in their system. Additionally, women are especially high risk because many of them are choosing to use oral contraceptives, and these synthetic hormones create an environment or terrain that's also conducive to the growth of the fungi and the yeast. And last, of course, is that many people choose to use antibiotics or failing to follow a healthy lifestyle program, and these antibiotics tend to kill off the good bacteria and promote the growth of fungi and yeast. So, of course, vaginal yeast infections are a common problem, but yeast can also cause other symptoms, and one of the common ones are chronic fatigue syndrome or fibromyalgia or even cancer. And I know that sounds surprising, but I actually ran a video of Dr. Simoncini, who's an Italian researcher, and is using strategies to eliminate yeast to very effectively treat cancer, so that if you're interested, that's something you might want to look at. But let me give you a few simple tips that are not commonly appreciated that can be very helpful at eliminating these common annoying problems. See, the yeast tend to thrive in an alkaline environment, so if you can adjust the pH of the vaginal area, you can frequently be successful at treating the yeast. And one of the ways that you can do this is by introducing boric acid capsules into the vaginal area, and you can do this for a week to a few months, depending on how severe the symptoms are. As far as I'm aware, boric acid capsules are not available commercially, so what you can do, though, is simply go to any drugstore and purchase boric acid. It's relatively inexpensive, and then you can also purchase capsules, a large capsule that you can fill the boric acid with, and then you can insert that intravaginally. And you can use that every day or a few times a day for a week or a few months, depending on how severe your symptoms are. Another thing you can actually do and insert is introduce lactobacillus probiotic intravaginally, because the lactobacillus actually makes, they call it Lactobacillus acidophilus, and they call it acidophilus because it makes acid. So it would also help change the terrain. So those are two important principles that you can use in addition to the other lifestyle changes I'm going to mention. And clearly, one of the most important ones is to make sure that you're taking that you're optimizing your diet. As I said earlier, it's the high concentrations of sugars, and remember that high fructose corn syrup is the #1 source of calories in the U.S., so it's not a surprise that these are complications. So if you can avoid things like sugars and keep them and limit them as much as possible, then it will be key. And what I've seen after treating hundreds and hundreds of women with this condition is that includes even what is commonly perceived as healthy sugars, because if a woman is suffering with a yeast syndrome, then even fruit should be avoided until the symptoms are under control, because yes, fruit, in my experience, will make most women with this condition get worse. So stay away from all the sugars until the condition is improved. Additionally, you can use fermented foods such as kimchi or sauerkraut or natto, but if these are not enjoyed or they're not in your diet routinely, then you are certainly going to want to consider the use of a high quality probiotic, a very good probiotic, and I've done another video on that you can look at for more information, but clearly that's going to be important. And you also want to stay away from chemicals, because it's real common for many women with this condition to have something called multiple chemical sensitivity syndrome. The women tend to develop into canaries, so they're more sensitive to chemicals and odors and smells, and not that these odors and chemicals are good for any of us, but they're more apt to suffer some complications because their detoxification mechanisms aren't optimized to handle that. And lastly, it's going to be really crucial to make sure that any significant underlying emotional challenges are addressed. And there's a number of different strategies you can use for that: prayer, meditation, traditional psychotherapy, or some of the newer energy psychology tools. And my favorite in that is an emotional freedom technique, which is a psychological acupressure, which has been very effective in our clinic, and there's tens of thousands of psychologists now who are using this really powerful technique. So hopefully this information will give you some simple, practical tips and tools that you can use to treat this really annoying and challenging symptom in so many women.